March is Endometriosis Awareness Month, and today we're learning about your treatment options and when it's time to see a specialist. Welcome back to the show, Doctors Trista Neuville and Jennifer Yaji. Hello, ladies. Dr. Neuville, I want to start with you. Many people are misdiagnosed when it comes to this disease. So what are the common and uncommon symptoms that we see?
The one that is most common that you'll hear is pain with periods or cyclical pain with menstrual cycles. Endometriosis is commonly associated with pain with intercourse as well as infertility, but some of the less common ones that people talk to us mostly about include gastrointestinal symptoms, so chronic constipation, bloating, diarrhea, which is commonly misdiagnosed, unfortunately, as irritable bowel syndrome or IBS. There can be urinary symptoms, painful bladder, as well as systemic symptoms of inflammation like chronic fatigue or brain fog.
I imagine then this can really impact your quality of life then, right, with everything that you just listed. Definitely. Dr. Yaji, what is your approach to surgically treating endometriosis?
So our surgical approach focuses on excision of endometriosis as opposed to ablation, which is what most general OBGYNs will offer. Excision surgery is essentially removing the endometriosis by cutting it out as opposed to ablation, which is burning just the most superficial layer. Excision of endometriosis, as you can imagine, by removing the disease has a higher chance of complete pain relief and a lower chance of recurrence than just burning that more superficial layer. What's tricky about endometriosis is it grows near other vital structures like the bladder, the bowel, the ovaries, the ureters, and so removing the endometriosis while preserving those structures and not damaging them requires a special skill set, and that's not generally something that's taught during general OBGYN training. Dr. Neuville and I have been fortunate to be able to do a fellowship with Dr. Masbrucker in endometriosis excision. A fellowship is when you do additional training after residency, and Dr. Masbrucker is really an internationally recognized leader in excision surgery and the founder of Pacific Endometriosis and Pelvic Surgery.
And what is the recovery like after doing a surgery like that?
So our focus is on doing the surgeries with a minimally invasive approach. So it's small laparoscopic incisions, and we use the Da Vinci robot to get better visualization and access to small spaces. So the benefit to that is the recovery is faster than when you hear about surgeries, years ago where there were open incisions. So, most people do need to take at least 2 weeks off of work or their usual activities, and then, the fatigue that can linger longer, can take 6 weeks or more. But I think overall the recovery, especially with our multimodal approach to treating pain, is better than a lot of patients would expect.
Definitely. And Dr. Neuville, why is it important to see a specialist? I mean, we touched on this because not everybody has the training that you all have, correct?
Yes, so similar training is not within traditional OBGYN residencies. And the first surgery is the best opportunity to optimize excision. Commonly, we will see patients who have undergone ablation, incomplete excision, or removal of the entire ovary due to an endometrioma. And those type of surgeries will usually cause adhesions or tissues to stick together, so it makes a more complex surgery. So a typical surgery that may last 2 to 4 hours is now lasting 4 to 8 hours. And that's why the first surgery by a specialist is going to be the best optimal time to remove all the disease.
That makes perfect sense. And as we mentioned, it's Endometriosis Awareness Month. So what can be done to increase awareness?
So, I think having conversations like the one this morning are really key in terms of getting information out to patients directly. It is an unfortunate statistic that it takes the average patient 7 or 8 years to get a diagnosis of endometriosis from when they first present with symptoms to a provider. It's not uncommon that we see women in their late 30s, even early 40s, who say, I've been having pain that made it hard to go to school or work since my teenage years, but people kept telling me it was normal. I think now more and more patients are getting information online, which is kind of a double-edged sword because there's some information out there that's great and some that is not accurate. And we really make a great effort to have a website that has accurate information for patients about endometriosis, some of the associated conditions like adenomyosis, interstitial cystitis, so that they can get good information. And it's our hope that people listening today will go to the website and learn more. Maybe there's someone out there who, some of the things that Dr. Neuville described, those resonate, and they can go read more about it. Other patients maybe already have a diagnosis of endometriosis, but don't know that there's options other than ablation. So,
and you guys are here for all of that information. So thank you, ladies, so much for being here. We really appreciate it.
New Day Northwest is sponsored by Pacific Endometriosis and Pelvic Surgery.